first of all, we have a pandemic that is affecting large parts of the world, not just the Western world and the Americas, but also Southeast Asia and in part also China and Japan. And that is the increase in body weight that occurs throughout the countries around the world. And this is associated with lots of dysfunctions of organs, such as the liver, the kidney, the muscles, the pancreas, and the gut, as well as the visceral fat, and eventually also the brain and the heart. And so this is an integration of all these different organ dysfunctions, but all these patients, eventually they die not of diabetes. They don't die of fatty liver disease or of renal dysfunction. They die of heart failure, myocardial infarction, strokes, or cardiac death. And that's why we have to bring this different organ dysfunctions together under the name of cardiometabolic medicine, which is systems cardiology, because it brings the systems together. And this new doctor has to understand the interaction of these organs. And if he wants to manage this pandemic properly that we are now facing around the world. That's a very important question. Obviously, these cardiologists have to be able to manage diabetes. And today, this is not as difficult as it looks like. Basically, the guidelines of the European Society of Cardiology suggest metformin, and in particular, sodium glucose transport inhibitors, and now also GLP-1s or GLP-1 GIP drugs. So we can really do this with some extra training in a very effective manner. Then also we have to learn that EGFR or renal function is a major cardiovascular risk factor, and that we can reduce the decline in renal function by sodium glucose transport inhibitors, the GLP-1s, but now also by the new non-steroidal mineralocorticoid antagonists. And similarly, we can improve the fatty liver disease or even reverse it with GLP-1s. And so we can actually bring everything together under the umbrella of novel drugs that are basically cardiovascular drugs, because eventually they reduce heart failure, be it HFpEF or HFrEF, myocardial infarction, stroke, and death. So this is really what I would call systems cardiology, because it brings the systems together not only diagnostically, but also in the use of specific novel drugs that have proven to be highly, highly effective in not only improving organ function, but eventually also outcomes at the cardiovascular or the cardiac level. Well, the European Society of Cardiology works closely with other societies to provide guidelines on diabetes and cardiovascular disease, on renal function and cardiovascular disease, on obesity, on lipids and their proper management, as well as in the future now also, as we are discussing with hepatologists, to also learn more about the liver, fatty liver, and cardiovascular outcomes. So I think we have to provide novel trainings. And as an example, we are running a cardiometabolic medicine postgraduate course in London, where during 4 days, participants learn everything they always wanted to know about all these organs and get updated in a manner to better take care of their patients. But eventually, we will also provide and this is in planning by the European Society of Cardiology postgraduate courses leading to a certificate of advanced studies, or even later a master degree in this particular field, to really foster this new specialty that brings together the knowledge of different aspects of medicine or internal medicine as it used to be in a manner to address the pandemic of obesity and its consequences on all organs of the body and eventually on the heart.